This video is continuing on cognitive behavior therapy, focusing on breathing exercises, but I'm adding some twists. Today, I want to deal with specialty topics, including pain, alcohol, being too tired, not motivated, being dysfunctional, and other things like that. Irritability is the number one as well. And we're going to do it by first reviewing breathing exercises and keeping ourselves present in the moment and in the foreground. Now, these videos are good that way because I'm present right in the foreground, but I'm also present in the moment. And I'm making these videos off the cuff without practice. It speaks to the practice I've had doing these breathing exercises because I demonstrate them so much, and the practice I've had teaching them to my patients and students at the university. So here we go on some extra topics. Why? Because there's complications in life. It's never smooth. We're doing breathing exercises. We're learning how to calm down our body and mind. But life brings stresses. Life brings complications in our body, our mind, and our context. And we've been dealing with breathing exercises for complications in context, such as a trauma and having nightmares and flashbacks and panic, is that we get sensitized on the periphery. For example, oh, don't touch that, it kills. Or our muscles are killing us, depending on the injuries. Or we get sensitized in our mind. We easily jump to the pain, and we say that's the worst pain ever. When we think about it afterwards, it wasn't that bad. And our pain neural circuits integrate with our depression and worry circuits, and they come to integrate together. So when there's depression, anxiety and worry, irritability or fear, it accentuates the pain. And overall, both of those can inflame the body. The pain experience, the emotional upheaval, and they feed into each other. Negative emotion, stress, feeds into pain and vice versa. It becomes a vicious circle. And we lose functionality and it becomes even worse. So we have to learn to stop the vicious circle as soon as it starts. Oh, my pain's starting. Oh, let me try the breathing exercises and not lose so much control or feel like I'm losing so much control. Maybe I can knock it down a point. Instead of a 9, it'll be an 8. Just let me try. The same with a headache. And use those techniques that I taught you. As we breathe in, the oxygen flows, and as we breathe out, the stress goes. And you follow the air from the nostril to the bottom of the lung, and it's a distraction technique already. And here I am going to yawn because I'm starting to do it. And maybe we kick in the beach, a pleasant scene of nature. Double whammy against stress. Double whammy against pain. And we can get into our pain, or we can move away from our pain. You're focusing too much on it. Let me focus on it using breathing exercises so I'm less scanning the pain and magnifying it in my mind. So let me just feel it where it is and be more calm about it if I can. Or move away. Oh, my neck is killing me from that whiplash. Dr. Young said to do my breathing exercises, get into it, wiggle my toes, occasionally here and there. So you start scanning your toes instead of your neck where it hurts. Move away from the pain site or move into it. Let me get into my neck. I'm going to be calm. Feels like an 8. I'm going to bring it down to a 7. I can do that. How am I doing that? By not magnifying it in my mind, controlling the depression that comes with it, and the stress, fight or flight response that comes with it. You can knock it down a point. and you can get more of a sense of control. And every little bit helps. So breathing exercises can help with pain the same way we saw that it can help with other bodily functions like headaches and sleep. Same procedure. It's really a one size fits